Nursing school exams hit different. In this video, I'm going to explain why that happens, why they're so hard, what you need to do about changing your studying, and give a little more detail to answer this commenter to explain more of what I mean with an example. First off, you may have already heard me say this, but before nursing school, you always get told what to study, and then you study it, you're tested on what you study, you do just fine. That changes in nursing school. Although you still get told what to study, if that's the only thing you study, like focusing on content, you're not going to be tested on that content. The majority of your questions is going to be testing you on how to think about your content. That's because nursing school, the one major goal of nursing school is to train you on clinical judgment. That is ultimately what the NCLEX is testing you on. So your nursing program better be helping you to develop that. And of course, you need it as a nurse. So you have to change your studying in nursing school if you want to keep up and still do well with the test. And the way you change your studying is to start studying the same way you're being tested. That means you can no longer only focus on studying the content, knowing the content, memorizing the content. Instead, you have to practice thinking about the content during your study time so that when you get to your exam, it's not the first time you've been thinking about the content. So to give an example then of what I mean of when I say you need to think about what you study, you need to think about the content. When you get a nursing school exam question, it's going to be something like patient presents to the ED with XYZ symptoms. Which of the following is a priority nursing action? And then the following four answers are going to be four things that you would probably do in that situation. A lot of people complain that it's like choosing all of these things are correct. Which one is most correct? But that's not actually true. You're prioritizing. There is one nursing action that is the most important for some reason. But in order to be able to confidently identify which of those actions is the priority, you have to be able to think through that question at a higher level of application or analysis. That means you're going to have to look at that little scenario in the question, and you're going to have to identify those important symptoms and be able to predict what it is that you think this patient's problem might be. In order to do that, you're going to have to compare those symptoms to what normal is. And that you're going to have to pull out of your brain, which is why A&P is so important. And once you've combined the most important stuff from the problem with what you know, now you can start evaluating the answer choices. And you will be surprised when you start studying this way how the correct answer just pops out at you. And amazingly, the best distractor pops out at you too, because now you're like, well, if I didn't understand this and was able to pull it out of my brain and combine it with this, I would have totally been tricked and thought it was this other answer instead. But if you're not practicing how to predict, and that doesn't just mean doing practice questions in your study time either, it's a way of thinking, then I'd love to teach you my silver bullet study system, and you can find links in the bio for how to work with me.